You know the drill. You feel sick, you call your doctor, and you're told the next available opening is in 3 weeks. When you finally get in, you get maybe a fraction of the doctor's attention before they have to move on. A standard traditional primary care appointment is booked for 10 to 15 minutes, but by the time the medical assistant checks your vitals and enters your chart, your actual face time with the physician is often just 5 to 8 minutes. Here is the math. On the left, traditional doctors manage 2,500 patients. On the right, concierge medicine caps panels at 300. Daily, traditional physicians grind through 30 visits. Concierge physicians schedule 8 to 12. Because the traditional doctor's schedule is maxed out weeks in advance, sudden illness leaves them with no buffer. Their only option is to send you to an urgent care center, where a stranger treats you without knowing your medical history.
The breakdown in your healthcare isn't a reflection of your physician's skill or dedication. It is a straight mathematical volume problem. Concierge medicine fixes the volume problem by strictly limiting the patient pool. The promise is clear: guaranteed same-day sick visits and comprehensive appointments that last a full hour. But that access comes with a steep barrier. You have to pay an out-of-pocket annual membership fee that usually ranges from $2,000 to upwards of $10,000. You have to ask if writing a large check automatically translates to a healthier physical body. Are you actually buying superior clinical medicine, or are you simply paying a premium for white-glove customer service and the ability to cut the waiting room line? To answer that, we need to strip away the marketing and look at the actual return on investment for that membership fee. We are going to map out the exact, tangible trade-offs of the concierge premium to help you decide if that financial effort makes sense for your specific situation. To survive on standard insurance reimbursements, a physician has to clear 30 appointments a day, operating in a constant sprint to maintain required operational margins. If you wake up with an acute issue, that sprint means there are 0 open slots. You are looking at a 1 to 3 week wait just for a routine follow-up or sec visit. This matrix compares the mechanical differences side by side. For wait times, traditional care leaves you waiting weeks, while concierge guarantees same-day or next-day access. When it comes to after-hours needs, traditional care redirects you to the nearest urgent care or emergency room. Concierge provides a 24/7 direct line to your specific physician. And the appointments themselves scale from a rigidly enforced 15 minutes on the traditional side to a flexible 60 minutes in the concierge model. In economic terms, you are buying idle capacity. The massive upfront fee compensates the clinic for seeing fewer patients, ensuring your doctor literally has nothing else to do when you need them. The concierge fee is simply the cost of making the clinic's schedule revolve entirely around you, instead of forcing you to fit into theirs. Before we go further, we have to correct a major misconception. Paying a concierge fee does not mean you can drop your traditional health insurance. You still absolutely need a standard insurance policy to cover major expenses, like emergency room visits, extended hospital stays, costly specialist referrals, and prescription medications. Look at this bar chart tracking annual healthcare expenditures. The baseline cost for a typical health insurance premium runs around $8,000 a year. When you add standard office copays and out-of-pocket labs, your traditional stack ends up around $9,000. For the concierge model, you start with that exact same $8,000 insurance base, but then you drop the annual membership fee right on top of it. Depending on the practice, your annual out-of-pocket costs can range from $11,000 to nearly $20,000. Joining a concierge practice adds a significant secondary layer to your annual budget, increasing your total healthcare spend by anywhere from 20 to 100% for the same clinical capabilities. When a doctor only has 10 minutes with you, they are forced to practice reactive medicine. You can only address one acute symptom per visit before time runs out. Expanding that visit to 60 minutes allows the physician to review all your lab work, read through your specialist notes, and map out long-term preventative health plans simultaneously. That extra time leads to measurable outcomes. Data shows concierge patients experience significantly fewer emergency room visits and achieve much tighter control over chronic diseases like diabetes and hypertension. But those outcomes aren't automatic just because you paid the fee. They require your proactive engagement in the preventative care plan to actually yield a return on your investment.
If you are caught between the broken scheduling of traditional care and the steep price of concierge, there is a third path, the hybrid option. Hybrid practices tightly cap their patient panels to offer 45-minute visits and same-day sick access, but they still bill through traditional insurance without charging a flat membership fee. You give up luxury perks like having the doctor's personal cell phone number for 24/7 access, but you avoid the massive upfront cost while still securing a highly efficient standard of care. To figure out who should actually write the check for concierge care, we use a framework called the scenario match. This chart plots the two variables dictating your decision. The vertical axis measures health complexity. The horizontal axis measures your time's daily value. Profile 1 sits in the bottom left. This is the budget-conscious, rarely sick individual with straightforward medical needs. If you fit this description, the financial return on a concierge membership is mathematically negative. You are paying thousands of dollars for access you simply don't use. Your best move is to stick with standard traditional primary care or locate a hybrid clinic. Over on the bottom right, we have Profile 2. This is the busy professional whose rigid schedule simply cannot accommodate 3-week wait times. For this profile, concierge care isn't a strict medical necessity. You are purchasing it as a workflow efficiency tool to optimize your daily lifestyle. If your body is healthy, your choice between these models is dictated entirely by your disposable income and your personal tolerance for friction. The math changes completely for Profile 3 at the top of the matrix. This is the complex patient managing multiple chronic conditions, daily medications, and a network of different specialists. The stakes here are high. Relying on fragmented traditional care with 10-minute visits often leads to mismanaged prescriptions and dangerous communication gaps between specialists. For this profile, the membership fee secures a coordinator to manage their entire medical portfolio and close the communication gaps between specialists. Proactive medical coordination acts like a synchronized engine, aligning specialists, test results, and daily medications to prevent systemic breakdowns before they ever occur. When deciding on concierge care, evaluate the fee as the cost of hiring a dedicated project manager for your physical body. A highly paid project manager is invaluable when coordinating a complex, high-stakes system. But if you only need the oil change twice a year, that manager is an unnecessary expense. If your biological project is complex, or your schedule leaves no margin for delays, the concierge fee pays for itself in efficiency and outcomes. Otherwise, traditional maintenance is adequate.